In this video, I will go over different conditions that can interfere with the normal function of the gallbladder. So here we have the gallbladder, and then we have the cystic bile ducts that joins the common hepatic duct to form the common bile duct. And then common bile duct joins with the pancreatic duct, and they all empty inside the duodenum. So with the pancreatic head cancer, what happens is that there is a blockage of the common bile duct. So since there would be an elevated concentration of conjugated bilirubin in these patients, since conjugated bilirubin can no longer get excreted inside the intestine, therefore these patients will have jaundice. And then there would be also a painless and distended gallbladder. So since the gallbladder cannot empty the contents, it keeps on getting distended. The next condition is Choledocholithiasis. So I want you not to confuse Choledocholithiasis with Cholelithiasis. So with this condition, there is a gallstone inside the common bile duct. And so as a consequence of which, these patients again present with the jaundice due to the elevated concentration of conjugated bilirubin, and then they also have a right upper quadrant abdominal pain. With cholangitis, there is inflammation of the common bile duct, and so these patients will again have jaundice, as well as a right upper quadrant pain and a fever. With cholelithiasis, there are gallstones inside the gallbladder itself, and so these patients usually have pain with meals, particularly fatty meals, which would enhance the excretion of the cholecystokinin and causes contraction of the gallbladder. And so these gallstones can go inside the cystic duct, and since they cannot get excreted and the gallbladder keeps on contracting, therefore the patients will develop pain, particularly with meals when there is contraction of a gallbladder. And then the final condition I'd like to discuss is the cholecystitis, which is the inflammation of the gallbladder itself, and it's caused by the presence of a stone inside the cystic duct that can lead later on to the inflammation of a gallbladder. And so these patients will have a right upper quadrant abdominal pain, and if you press against the right upper quadrant of the abdomen and ask these patients to take a deep breath, they wouldn't be able to complete the inspiration. So they stop because it hurts their gallbladder. And this is referred to as a positive Morphy's sign. Alright, now that I discussed every one of these conditions, I would next like to go into more details and discuss every one of them again. So the first condition is the pancreatic cancer, 75% of which are inside the pancreatic head. And these cancers arise from pancreatic ducts. Risk factors include the cigarette smoking, as well as chronic pancreatitis, for instance from gallstones, alcoholism, or high levels of triglycerides. Then other risk factors include age of more than 50, Jewish, as well as African American male is other risk factors, and then finally diabetes is another risk factor to the development of the pancreatic cancer. So the features of this cancer is that patients will have abdominal pain, and obviously because of the cancer they will have weight loss. They will have jaundice since there is an obstruction of a common bile duct. So there would be elevated concentration of conjugated bilirubin, as a consequence of which patients will develop jaundice, and they would also have dark urine with light colored stools. Other features include the Courvoisier's sign, where there is a palpable gallbladder without pain, so enlarged distended gallbladder without pain. And then the other feature is migratory thrombophlebitis, where there is an increased risk of coagulation. So clots keep on being formed in these patients, they resolve and then form again. And one complication that may arise is the Trousseau syndrome, where there is redness and tenderness on palpation of the extremities. So for the diagnosis of these patients, the tests that you can order include, for instance, ERCP, CT scan of the abdomen. You can check for the CA 19-9 level, and that is used for the diagnosis of a pancreatic cancer. So the way I memorize it is that 19-9, so the 9 is mirror image of P, pancreatic cancer. So that's how I remember that 19.9 is associated with pancreatic cancer. And then you can also measure the CEA levels, but this is less sensitive than the CA 19.9. And then for the treatment of these patients, you can perform the Whipple's procedures, the other name for which is the pancreatoduodenectomy. The next condition is the Choledocholithiasis, and as I just mentioned earlier, it's because of the presence of a gallstone inside the common bile duct, and the clinical features of this disorder include the right upper quadrant abdominal pain, jaundice, elevated total and direct bilirubin, as well as elevated alkaline phosphatase. And then for the diagnosis, you can perform the ultrasound or ERCP, which is the gold standards. And then for the treatment, you can perform stone extraction and stent placement. The next condition is the Cholelithiasis, where there are gallstones that are present inside the gallbladder, and then there are two forms of gallstones. One is the cholesterol gallstones, which are radiolucent, and then the other form are pigment gallstones, which are radio-opaque. So the risk factors to the development of cholesterol gallstones include, for instance, obesity, Crohn's disease, advanced age, fibrates, estrogen, multiparity, as well as rapid weight loss. And the memory aid that I have for you is FFFF, which can help you remember the risk factors to the development of cholesterol gallstones. So female, since they have more estrogen production; fat, again, there is more estrogen production due to the conversion of the androgen into the estrogen via the fat tissues; and then 40, as well as fertile. These are all risk factors to development of the cholesterol gallstones. As for the pigment gallstones, these are from chronic hemolysis or alcoholic cirrhosis. And then complications that may arise from cholelithiasis include the biliary colic, where there would be pain in the right upper quadrant of the abdomen after eating fatty meals, which enhances the secretion of the cholecystokinin that causes gallbladder contraction. And so some of these stones will get stuck inside the cystic duct, and so there would be pain because the gallbladder is now trying to contract against a stone inside the cystic duct. And then the other complication is gallstone ileus, where there would be a fistula between the gallbladder and the small intestine. And so the gallstone can now move into the small intestine and cause bowel obstruction, while the air from the small intestine can now go into the gallbladder, and thus you will see air in the biliary tree. So if you see a patient with abdominal pain and then you find out that there is a bowel obstruction, and then studies show that there is air in the biliary tree, you should know that it's a gallstone ileus for the diagnosis of that patient. And that the diagnosis can be confirmed by the ultrasound or a HIDA scan. Next, we have cholecystitis, which is inflammation of the gallbladder itself, and this is caused from the positioning of a gallstone inside a cystic duct. And so these patients present with a right upper quadrant pain, positive Morphy sign, where there would be an arrested inspiration on deep palpation of the right upper quadrant. So you palpate the right upper quadrant of the patient and ask them to take a deep breath. They cannot complete the inspiration because it causes pain, and that is referred to as positive Morphy sign. And then they can also present with a low-grade fever and leukocytosis. And for the diagnosis, you can order ultrasound as a test of choice. Other options include CT scan as well as a HIDA scan. And then the treatment options include the IV hydration, NPO, as well as pain management. Now there is one other condition that you should be familiar with, and that is called a calculus cholecystitis, means that there is an inflammation of a gallbladder without any stones inside the cystic duct. And usually the triggers to acalculous cholecystitis include a severe underlying disease or severe trauma, for instance, burns, or dehydration. And for the treatment of these patients, they will have to undergo cholecystectomy. And then the final condition is cholangitis, where there is an infection of a biliary tree secondary to the obstruction, usually from Choledocholithiasis or from the pancreatic cancer. So these patients present with a Charcot's triad of right upper quadrant pain, jaundice, as well as a fever. And then some may also present with a Raynaud's pentad, where all these Charcot's triad would be present. So 1, 2, and 3 would be present, in addition to the septic shock, as well as an altered mental status. So for the diagnosis of these patients, you can order ultrasound, lab tests. Like for instance, you can order levels of white blood cells to look for leukocytosis, check for hyperbilirubinemia, as well as elevation in the levels of AST and ALT. And then you can also order ERCP. And then for the treatment, you can give them IV antibiotics as well as IV fluids, and then you can decompress the common bile duct by, for instance, catheter drainage. And that concludes our discussion of the gallbladder disorders.